Hello and welcome. Today we're diving into a condition that's so often misunderstood, obsessive-compulsive disorder. We're going to explore what it really feels like, look past all the stereotypes, and most importantly, talk about the path toward finding real peace. When your mind won't let go. That sentence just cuts right to the heart of it, doesn't it? It's that feeling of being completely stuck in a loop, where it feels like your own mind is turned against you. It's relentless, and it is just exhausting. If that question hits home for you, if you've ever felt like you're a prisoner to thoughts that just repeat and repeat and repeat, then you are in the right place. What you're experiencing is so real, and you are absolutely not alone in this. So that feeling of a mind that just refuses to let go, that's the very core of OCD. And it's so crucial to understand that this isn't some kind of character flaw or a matter of not having enough willpower. It is a recognized, and this is the most important part, a treatable condition. Do any of these sound familiar? Maybe it's the constant mental replay of a conversation or the urgent need to check something over and over just to quiet that awful feeling in your gut. These aren't just little quirks. They're common signs that someone is silently struggling with OCD, often while trying to appear perfectly fine on the outside. The key thing here is the distress and that feeling of being trapped. Okay, this is so important. We hear the term OCD thrown around all the time, right? Usually to describe someone who just likes a really tidy desk. But that common stereotype completely misses the reality of what this disorder actually is. Let's clear that up right now. This right here is the critical difference. Liking things neat, that's a preference, maybe a personality trait. But OCD, well, that involves these intrusive, unwanted thoughts. We call them obsessions that create this huge wave of anxiety. The behaviors that come next, the compulsions, are really just a desperate attempt to get a moment of relief from that anxiety. At its core, OCD is a vicious cycle. Think of it like a faulty smoke alarm in your brain. The obsessive thought is the alarm, screaming danger when there's no fire. The anxiety is that horrible, piercing noise. And the compulsion? That's you frantically hitting the snooze button. You get a moment of quiet, a little relief, but you know that alarm is just going to start screaming again. It's that exhausting loop that can totally consume a person's life. And another thing is, it is not a one-size-fits-all diagnosis. Not even close. The way OCD shows up can be dramatically different from one person to the next, often latching onto their deepest fears, which leads to several pretty distinct types. What most of us picture is classic OCD, the checking and the cleaning. But what about the stuff you can't see? That's where you get pure O, or pure obsessions, which is this incredibly intense, silent battle that happens entirely inside someone's head. Or take relationship OCD, which can flood a perfectly loving partnership with constant, crippling doubt. Understanding these different forms is absolutely key. But here is the most important message of all. There is a clear path to recovery. Living with OCD is exhausting, I know, but you do not have to figure this out on your own. Effective, proven treatment exists. So what does that path actually look like? Well, it's a structured, supportive process. It starts with a real deep dive into your specific experience in a totally judgment-free space where you can finally feel understood. From that understanding, a plan is built just for you because no two people are the same. And crucially, the support keeps going. It's a true partnership to help you stay on track for the long haul. A good treatment plan is really comprehensive. It might include medication like SSRIs that can help regulate brain chemistry and just turn down the volume on the symptoms. The absolute cornerstone of therapy is often something called ERP, that's exposure and response prevention. It's where you learn to gradually face your fears in a safe way without performing the compulsion, basically teaching your brain that you can handle the anxiety. When you combine that with looking at nutrition and lifestyle, you've got a really powerful, holistic approach to getting well. Finding the right support system is just everything. The environment where you decide to get help can make a monumental difference in your recovery journey. So what should you even look for? Quality care is about so much more than just a prescription. It's about finding professionals who are not only experienced, but are also compassionate, who just get it. It's about having integrated services that treat you as a whole person. And maybe most importantly, it's about finding a private, stigma-free space where you feel safe enough to finally talk about what you've been holding in silence for so long. Okay, let's bring this all together with the most vital takeaway. After understanding the struggle and the path to getting better, it all comes down to this one simple, powerful truth. I want you to just let that sink in. The intrusive thoughts are not a reflection of your character. The compulsive behaviors are not who you are. They are symptoms of a disorder, and a disorder is something you have, not something you are. You are the person underneath all of that who absolutely deserves peace. So I'm going to leave you with this question. Just imagine, what would it actually feel like to quiet the noise, to reclaim your time and your energy, to trust your own mind again? That peace, it's not a distant dream. For so many, it becomes a reality. It is possible, and it is so, so worth fighting for.